Welcome to this video on circulatory shock. In this video, I'm going to talk to you about the various reasons that shock can occur. So, circulatory shock is defined as a rapid drop in blood pressure. And I'm going to use BP for blood pressure. If this is not corrected rapidly, then it can lead to organ failure. Now, over here I put a couple of the equations that cardiac physiologists like to think about when they are studying how our circulatory system works. Your blood pressure is equal to your cardiac output times your total peripheral resistance. What that means is that the amount of blood that your heart is pumping is not all that is going to determine your blood pressure. It's also going to be determined by how much resistance there is to overcome. And for the most part in our bodies, that is going to be determined by how much blood we have, the blood volume in our blood vessels, and how narrow they are. So if we see a big change in blood vessel diameter, so how narrow the blood vessels are, narrowing of the blood vessels will increase this. And conversely, dilation of blood vessels will decrease resistance and make blood pressure go down. And then the other thing would be how much fluid is in the vessels. Because if we don't have a lot of blood in the vessels, then no matter how hard our heart tries to pump, it's not going to be able to have a high cardiac output. So the other thing that comes into play here is narrowing or leakiness. That's the term I like to use for how much the blood vessels are letting fluid leave. Okay, so without further ado, let me show you the different kinds. So the first kind we'll talk about is called hypovolemic shock. And that word, if you take it apart, means less than volume, so low volume of blood. And I'll come back to the causes of this in a second. Let's go ahead and highlight this in yellow though. So hypovolemic shock is one reason that people can go into circulatory shock, and that's because they just don't have enough blood volume. And then the second reason that I'm going to focus on is systemic inflammation. And this is usually going to be an immune response to either infection or an allergic reaction. So I'll come back to this one too. And then a third reason that someone could have a rapid drop in blood pressure, potentially leading to organ failure, could be a heart attack or damage to the heart muscle itself. So that we call this cardiogenic. And this would be due to heart muscle damage. And then a fourth reason that someone could have a rapid drop in blood pressure would be what we call neurogenic causes. And this is typically going to be if they had trauma to their brain or spinal cord. And then at the end of the video, we will briefly talk about something called syncope, which is fainting. That's a fancy word for fainting. And it is caused by a short-term drop in blood pressure, but usually the person has a quick recovery, and this is not considered life-threatening the way that the other types of rapid blood pressure drop followed by a hard time getting it back to normal. So this is not life-threatening syncope, but we will talk about it because students often have a lot of questions about that. Okay, so going back up to the top then, for hypovolemic shock, starting us out, the first cause is traumatic injury and blood loss. So let's use a red pen for bleeding, maybe from an injury of some kind. So traumatic injury. And we would call this hemorrhage, or sometimes hemorrhagic shock. So that could cause hypovolemic shock. So it could be caused by blood loss. And you can draw a little red blood cell right here. But the other reason that it can happen, you can put an arrow right here, like that, is fluid loss. So now I'm going to switch to my blue pen, and or fluid loss. And you're going to see this basically in severe dehydration. So maybe excessive sweating if someone is in the desert and doesn't have water. Or we can also see this with elderly people where they just no longer have that drive to drink anymore. Their hypothalamus is not communicating that to them. So in nursing homes, it could be lack of thirst, so they're no longer taking care of their basic water needs. So we can put a sun up here, but in a typical healthcare setting, it's more likely to be an elderly person that is just no longer drinking the way they should. Okay, well, another would be diarrhea. And this would be severe diarrhea I'm talking about. For example, a disease like cholera that is so much watery diarrhea that someone could die in a couple of days and go into hypovolemic shock from that. Or polyuria. And you maybe have heard that word. It means much urine. And this could be from someone that has had very high blood glucose for a number of days, and they've been getting progressively dehydrated until they may even end up in what's called diabetic ketoacidosis. Now, this situation is most common with type 1 diabetics. It's less common with type 2 diabetics. But type 2 diabetics can still get to a place where their blood glucose has been so high for so long that they have urinated out so much that they get very dehydrated. So this could be due to high blood glucose. Sorry, so that says due to high blood glucose. Okay, let's see if we can make an arrow this way. Some days I can do these arrows, and other days they don't work. So far, so good. So this would be from fluid loss, whether it is diarrhea or, so like a watery diarrhea, or sweating, or just not drinking enough water. Okay, so the next type of circulatory shock that we can see would be systemic inflammation, and always this is going to come down to leaky blood vessels. So I'm going to make this capillary here. This represents a blood vessel. I'm going to write this with my black pen. So a blood vessel, and inflamed blood vessels are leaky. So I'm going to use blue for this. So leaky blood vessels lose water, and so someone could actually become edemic and have a lot of fluid in their tissues but not in the blood vessels. So leaky blood vessels lose water. And the two main ways that we'll see that happening is number one would be septic shock. So I'm going to use my green pen to describe this one. So septic shock, my green pen has seen better days, hasn't it? So septic shock, and this is going to usually happen due to overwhelming infection. It could literally be because the bacteria is so much everywhere in their body, or we could see it in situations where there's not a lot of the bacteria, but the bacteria is causing a release of cytokines from our own immune system. And so then we get into this inflammatory situation. So local inflammation is good for solving problems, but if you have leaky blood vessels everywhere, then that's going to cause your peripheral resistance to go down. So this decreases cardiac output and peripheral resistance. So it's by decreasing peripheral resistance first, and then eventually it's decreasing cardiac output, and both of these will therefore decrease blood pressure. So, that says, so a decrease in peripheral resistance and cardiac output will therefore decrease blood pressure. So here the doctor is saying, I'm afraid your infection has reached the bloodstream. And this patient then may actually go into septic shock where their blood pressure drops precipitously because they have leaky blood vessels all over their body. Okay, then we're going to have the same kind of problem over here, but instead of the systemic inflammation being caused by an actual bacteria, instead it is caused by an allergen, and we call that anaphylactic shock. And this is due to an allergic reaction. And I have on here some different examples. So I'm going to use my black pen again. For example, a bee sting is a classic one, but it could be an insect bite, or it could be venom even. Could be a variety of different sorts of things like that. Foods, I have here a drawing of a peanut, which is a classic one, but it could also be a variety of other kinds of foods. And then I have penicillin, an example of a medication. So people can have allergic reactions to anything in their environment. Some of the most famous ones, though, would be insect bites, different foods, and different medications, especially antibiotics, seem to be pretty well known for that. Okay, so now let's go on to cardiogenic. And I want to put a couple more arrows on here. So systemic inflammation could lead to septic shock if it's bacterial, or anaphylactic if it is an allergic reaction. And by the way, the purpose of an EpiPen, so that's epinephrine, an EpiPen injects epinephrine into the person that's having the anaphylactic response, and it will constrict the vessels, and it will dilate, so the bronchioles. So this helps the person be able to breathe better because they've had constriction of their bronchioles during the inflammatory response. And the constriction of the vessels will block any further leakage that's occurring. And so that's why an EpiPen works in that situation. Okay, a cardiogenic form of shock is when there has been heart muscle damage. I'm going to use a red pen here. Heart muscle damage. So this is going to be most classically due to a heart attack, a broken heart, so the pump isn't working, and so this one has nothing to do with peripheral resistance and everything to do with a decrease in cardiac output. But this is going to decrease blood pressure because in order to increase blood pressure, you need to have adequate cardiac output. So if the heart is no longer pumping enough blood, then you're going to see a decrease in blood pressure. And then, let's use our arrow here. And then neurogenic, I will use my purple pen for this one. Neurogenic shock is usually due to damage to the brain or spinal cord. So damage to the central nervous system that is controlling usually like vasodilation, so through the brain stem. So it could be the brain or the spinal cord. And the times you're going to see something like this is if someone has, let's say, had head trauma, maybe a car accident that damaged the vasomotor centers of their brainstem, so they're not able to keep their blood vessels constricted properly. A stroke could have damaged parts of their brain that do that, or a spinal cord injury. So in any of these, a patient could present then with circulatory shock due to neurogenic causes. And what you can see here is that although this could have an effect on lowering heart rate, we're also going to see a decrease in the ability to constrict the blood vessels. So we might have a decrease in peripheral resistance, which will lower blood pressure. All right, what I noticed that I didn't do up here with hypovolemic shock is I did want to, let's use a black pen here. If you lose, sorry, I'm going to use my blue pen because I want to put some droplets right here. If you lose blood, then you are going to have a decrease in peripheral resistance because there's less fluid in the pipes. And then eventually, you're also going to have a decrease in cardiac output because you're not having enough fluid in the pipes, and so that's going to decrease the amount of blood that even a strong heart can pump, and that is going to ultimately decrease blood pressure. So you'll notice that hypovolemic shock and systemic inflammation are both decreasing blood pressure leading to shock, but what's happening here is that the fluid, the reason peripheral resistance is going down is because water is going into your own tissues. And in hypovolemic shock, the reason that peripheral resistance is going down is because fluid is literally being lost from the body, either through blood loss or diarrhea, or I guess it could be, or sweating, or not drinking enough fluid. So now, as I wrap up, I wanted to wrap up those. I want to go down to syncope and explain that a little bit better to you. So this is something, I'll use my purple pen again. You should see a quick recovery. I'm only dealing in this situation with those times when someone faints and then they recover rapidly. So we're not talking about something life-threatening like the other situations. And what we see a lot of times is that this is caused by an extreme sympathetic response. I'll give you a good example down here. Let's say that someone sees a needle and they think that they're in their brain, they're thinking, I could die right now. I could die. And then they realize, oh, I'm fine. They have had this sudden cessation of their sympathetic drive. So it's like they get this huge upward sympathetic response followed by a cessation, a rapid. And cessation means a stopping. And this causes too rapid of a decrease. And then they might faint. So that is oftentimes what happens when someone says, phew, I survived. And then boom, right after that, they might faint. Okay, then maybe another situation is when someone is laying down, they get up too fast, and then they pass out. We might call this orthostatic hypotension. Oops, sorry. Running out of room again. And this ortho means right. And so when they stand upright, then they get low blood pressure. And this can happen. Some people have a genetic predisposition, but all of us as we get older don't have quite as quick of sympathetic tone to get our blood pressure up when we stand up. So we see this more often in older people. And then, I wanted to give an example over here, something called the Valsalva maneuver. This is when you bear down. And when somebody bears down, then they can actually mechanically stimulate their vagus nerve, and then that will slow down their heart rate too much, which will decrease their cardiac output, and they will literally pass out, not have enough blood pressure. So you'll see that happen sometimes when someone's really bearing down to lift weights. again in elderly people when they are bearing down for a bowel movement on the toilet. And that's one of the common reasons why in nursing homes they have the emergency cord right next to the toilet, because it is common that they will pass out in the bathroom. And then I didn't draw a lady having a baby on here, but sometimes during labor, this can happen too with women. So it's called the vasovagal reflex. When somebody is passing out, and it can sometimes be because of too much mechanical stimulation of the vagus nerve, which slows down heart rate, or it can be from getting up too fast and their sympathetic nervous system doesn't have time to constrict their blood vessels and pump their blood harder to their brain, and so then they might pass out. And then the other example I gave here is when someone has this really, really rapid spike in their sympathetic nervous tone, and then when they think they're okay, then the nervous tone goes away too fast, and all of a sudden now they pass out. So we see this like after a car accident. Let's say they weren't even hurt, and then they realize they're okay, and then they pass out after the danger is over. Like I showed on here a needle about it, like a medical procedure. And maybe like if someone had to have their blood drawn, similarly to that. Okay, I will see you in the next video.